is Debbie Falanga. I'm a liver transplant coordinator. I've been doing this job for almost 19 years. I am one of the first contacts that the patients have or the physicians have. We will either get calls from a doctor's office letting us know that they have a patient that needs to be evaluated for transplant, or the patient will call us and tell us, my doctor recommended that I need a liver transplant. I'll ask them their name, address, phone number, contact information, their doctor, his phone number or her phone number, and just some basic information if they've ever had surgery before, if they have any other medical problems, what medications they're on. If they don't have all of the information at hand, I can always get that on their first visit, but try to get a little bit of information. And then I will ask them to have their records faxed to us, because that's generally the quickest way for us to get them. We're usually able to see patients within a week or two of getting the phone call, so that if they're real anxious or if they're real sick, we can at least get them in the door and have them assessed. And then on their first visit, we have the hepatologist, the liver specialist, meet with the patient. He will review their records. We do blood work, because blood work is one of the ways we assess liver function and how we list patients. And we're able to tell the severity of their liver disease by their blood work. So he will review the records, examine them, get a more detailed history from them. We do like them to bring their medicines with them so we can get an accurate list of the medicines, and review the blood work, and then he can tell them at that point, yes, you do need to be evaluated for a liver transplant, or actually you're a little bit early, we can follow you for a while until your liver disease progresses, or he may have some other medical therapy that he recommends other than liver transplant. But that's what we do at the initial visit. If you're a patient calling me asking me how do you get on a transplant list, then I would tell you that we need to see you initially as an initial visit. If it's determined that you do need a liver transplant, we will set up an evaluation of tests for you to make sure that medically that it's safe for you to undergo transplant, because it is an operation. And depending on the severity of your liver disease, which we assess by the blood work, if your liver disease is really bad, then we work you up quickly. We can usually work up people, evaluate them by the next week after we see them. Depending on the severity of your liver disease really will depend on how long you wait. There's a mathematical calculation that we do with the blood work called a MELD score, and that's actually how you're listed. You're listed with your MELD score and your blood type. If your MELD score is really high, you will be at the top of the list and you will have a fairly short wait. Also, depending on your blood type, determines how long you may wait. Since people that have blood type O, that's the most common blood type, people that have blood type O tend to wait longer. Our average wait is about a little over a month. It's 35 days, depending on severity of liver disease. I am your mediator between you, the patient, and the doctor, so that if you're feeling bad or if you have any questions or any concerns, we're your contact, and we contact the doctor directly and we address your needs as the urgency requires. So the more urgent your needs, we can page the doctor, we can address it right then and there, or we can bring you back to clinic. I know that transplant can be really scary. If I were a patient, I would be afraid. But I know that we can help you. I see patients that we've helped. I've seen hundreds of patients who have gone on from being really sick to being really well after transplant, and patients who are jaundiced before transplant or really pink after transplant. And that's the greatest satisfaction of my job, is seeing that I'm able to help people to get better and feel better, and have patients come up to me after transplant and tell me that they feel wonderful, and that's really the joy in this.